It now has a clearer sense of who would win and lose under the health bill that the House sent them. It also got a startlingly direct message from government analysts about how destabilizing one of the House ideas could be. The Congressional Budget Office report on health care is very direct. How will this impact you? News4JAX political analyst and director of the JU Public Policy Institute, Rick Mullaney, joins us to offer some perspective. So, Rick, let's talk about the 23 million number. 23 million fewer people covered by insurance that are covered by the Affordable Care Act.
That's a projection for the CBO as of 2026. And by the way, this is the second CBO report. The first one came out in March on the House first bill. That was a 24 million number. This 23 million is a significant number. Republicans will argue that it's misleading, that they've done away with the mandates, and that the ultimate bill will look very different than this. But in the end, that is a very difficult number for Republicans.
Now, there are really two big numbers that we have to pay attention to, that 23 million and also $119 billion. Question is, which matters most? The delta between how many people will be covered between Obamacare and Trump care if there's a change, or the money that the country is going to save on debt?
Yeah, let's separate those. The one, of course, relates to coverage, and that's a very important number. The other relates to the deficit in the 120 million ballpark that will be cut over the next 10 years. That's significant for a number of reasons. One reason is under budget reconciliation rules. If it was not a deficit, if it did not reduce the deficit, you'd have to start back over in the House. So the good news for the House is that it does reduce the deficit, therefore it continues on to the Senate. The bad news, of course, is that number was 337 back in March under the first report. It is a relatively small number. In the end, Bruce, I don't think the bill's going to look anything like this when it comes out of the Senate. And even the Senate bill probably won't be the final version because this is going to be done in some phases. So in answer to your question, both numbers are very important, but for different audiences.
But politically, as things stand now, this is not terribly good news for Republicans who hope to avoid midterm losses in 2018.
No, it's a good thing that November elections are a year from November for Republicans right now, at least with the CBO report. Republicans will be critical of the CBO report. They'll try to minimize its impact, and they'll try to say things are changing, but it is problematic. And as you might have expected yesterday, Democrats jumped all over the CBO report, claiming that the House bill truly was draconian, that it involved tax cuts for the rich, that it was going to reduce coverage. And so you're going to see this be a very, very big political issue for the November 18 election, no doubt about it.
Now, the CBO report really only captivates those in the Beltway and in D.C. I don't know that the average person really cares. What is the bottom line for us?
Well, right now it's a lot of, right now the real bottom line is that the eventual health care bill is not going to look like the House bill. And right now this is a lot of conversation, and you can follow this inning by inning, or you can sort of wait till the game is over. And for right now, this is very fluid and it's going to change. The Senate themselves have said they intend to rewrite the bill. Once they do, it's going to go back to the House, and then you've got the Freedom Caucus in the House, and it's going to be see whether you can even get the votes there. Mitch McConnell himself says it's going to be very difficult to get 50 votes in the Senate. So in the end, for the public listening in, there'll be a lot of conversation, a lot of shifting around, but the bill that you're going to get in the end, I don't think is going to look like the one you're seeing today.
What do you think it'll look like?
You know, it's really not really clear that one will get passed. I think it's going to be really challenging. The centrists in the Republican Party want to make sure that there's greater coverage. The far right, of course, is concerned about lowering premiums. That tension between the two is difficult within the Republican Party itself. And then, of course, you have Democrats voting in bloc against all of this. So in the end, it's going to be very, very challenging. Remember, this House Bill 2 cuts about $800 billion, more than $800 billion from Medicaid, which is one of the reasons why there's less coverage. As Donald Trump himself said, this is very complex. This is and it truly is complex.
It is complex, it is fluid, it is ever-changing, and we'll stay on top of it. Rick, always a pleasure. Thanks. By the way, you can revisit this interview if you want to gain your own perspective and figure out how this is going to impact you and your family. It'll be posted on news4jax.com after about 10:30 this morning. Just go to the video section.